All right, for step number 2, or option number 2, I want to talk about strength training. I like to say that, you can be too big, but you can never be too strong. And that carries a lot of interesting concepts too, because with being too large, bulky, that may have some hindrance on everyday life, right? But you can be really strong and not be very large. And I always like to, encourage my population that I influence to kind of move towards that desire, that goal at least in their life. So. I know you guys, you see a healthy group of elderly people in your offices. Sure. Yeah. What do you guys see with the importance of strength training and why that is so important in that population?
Great question, John. I think one of the things, and you kind of alluded to it before, Dr. Vincent, about, we talk about balance, we talk about strength, and how those really go hand in hand, I think, as we age, because, we definitely see patients who have significant, I would say, limitations. Part of it, maybe because of their chronic illnesses, but some of that can just be as we age, as we become more obese as a population, which is just, it's an inevitability, I think, in some people's minds that's just part of the aging process, right? You go back to the 20-year reunion, the 30-year reunion, and you just expect people to look so much different and to have put on weight and things like that. So you're surprised when you actually go to one and you look and go, oh my goodness, wow, look at this, look at this person. And so we think of it that way, that it's just this inevitability, but like you had said previously, I think that there are ways that we can help avoid that, delay that, even correct that, by increasing strength. It definitely helps with balance. And so I think we have patients where, as they get deconditioned, even from coming out of the hospital, let's say like with pneumonia, I mean, COVID aside, patients who have had pneumnia go into the hospital for a lengthy stay and they come out and their bodies get deconditioned in such a short period of time of being in the hospital. And so, we get therapy VEC involved because we just want them to get stronger so that they can get back into everyday life. Yeah. And I think that strength and balance component is such a key one, because we see so many patients who suffer from falls. Because their bodies become deconditioned, because they lack the strength, or like you had mentioned before, just bending over to pick something up and they lack the strength to get back up. And I think that's thinking about how to strengthen the body, I think is just such a key, for us as we age here.
On that point, you mentioned, a hospital visit or some type of adverse thing that happens in your life. I would imagine the stronger we can go into something negative that has happened to us, the better off the outcome is going to be on the other side of the surgery, the infection, or whatever we're fighting, right? So to prepare ourselves going into whatever ailment we're going to be facing, having as much capacity with strength going into that problem is going to yield tremendous benefit as you fight through
Absolutely.
that.
I'm sure that you've probably seen patients who are getting ready for a joint replacement. And
two different worlds.
Two
different worlds. The person that's able to do a ton of things, whether it's cooking every day, exercising, and they just, hey, my knee hurts, we've done the injection thing, whatever, but I mean, their quads are good, their calves are good, and more importantly, to the point of just day-to-day life, they have things that they want to do. So that person is completely different than, I was already using a walker, my knee just hurts and it's just in pain, but I'm spending most of the day in a chair. That person will have a knee replacement. Unfortunately, that person may be in the hospital a couple of days working with physical therapy because they haven't done anything for so long. Meanwhile, the person prior, if their surgery is early enough in the morning, they're getting discharged that night. So it's really one of those things where when you consistently have an expectation and function of living that you want to achieve, and really strength is a large component of that, just carrying out, whether it's using your larger muscle groups, I mean, and that obviously gets down to even your finer muscle movements, with folks that, whether you knit or put together ships or race cars or whatever your hobby may be. I mean, these are all things and tangible things that you can reach towards and reach to like really motivate yourself to maintain it. And it's just, it can't be stated enough that that's how important just strength overall is. And it's not something that you just lose either. It's a slow process, fortunately and unfortunately. Unfortunately, because a lot of folks think that it's just I'm getting older, so let's just lose it. But fortunate to say, hey, no, wait, stop. We can kind of put a pause on that, and we can kind of reverse it a little bit. So that's it's really important.
That's great. That's great.